I'm Rick Buck, and I've been a dentist for 15 years. I'm going to show you in this video from start to finish how I replace a missing tooth with a dental implant. So subscribe if you have teeth or want to replace them. What you're looking at here is the area where we're going to put the implant and the crown on the day of the first procedure. After about 10 minutes, I check to make sure the patient is numb by poking the gums. Immediately, the next step is to make incisions in the gums with a scalpel and use a periosteal elevator to pull back the gums and expose the underlying bone. Now, I do it this way. Some dentists will do the implant straight through the gums without pulling them back, but I don't recommend that as it prevents us from verifying the most important step that we will see later for implants. Peeling the gums back actually takes a little bit of force, but now they are moved back, and that is what the jawbone looks like that you can see now. So as I'm planing out the bone here and it's even, I'm ready to start drilling a pilot socket into the bone where the implant will go. So this is the pilot drill that I'm using right here. When it is complete, the socket is going to match perfectly the dimensions of the implant that we will fill it with. That implant is about 8 millimeters long, so that is the depth that I'm drilling into the bone right now. The alternating black and metallic lines on the drill, if you can see them, are telling me how deep I am drilling. Now, I also want to note that the bone here is actually really solid, so it is taking me a minute or two to drill through it. Sometimes this actually happens really fast. Another side note is that you need to use plenty of sterile water so the friction doesn't burn the bone as you're drilling on it. As we start drilling, we also need to make sure we don't go too deep because there are important nerves that run fairly close by. Now, this is all separated by a couple millimeters, and if you take great care, you're likely never going to run into those nerves. And to me, that has never happened so far in the 13 years I've been putting implants into place. Now, after drilling quite a bit of time, eventually we're going to the right depth, but now that it's the right depth, we need to make the socket the same width as the final implant that will be in there as well. So we use a series of drills, each one wider than the previous, until we get to the correct width of the implant that we are about to place. You can see as I've gone through a few of these now how wide the socket looks. In fact, that socket is about 5.7 millimeters. So now let's just take a look at that socket for a second, because after this, that socket is going to be permanently filled with the implant. So now I take that same drill and I set the speed a lot slower, and I attach the implant, which will fasten into place in the socket. Now, once again, the dimensions of the socket are exactly the dimensions of the implant we are going to fill it with. So when you see this implant, you know that's about the size of that same socket that is going in. You can see the implant is slowly rotating down into the socket until it firmly stops. Now, just so you know what you're looking at, the top piece sticking out of the bone is just what we use to connect our hand piece to put the implant into place. And also, we'll use this in the future to take an impression with, but that is not the actual implant. So we call that piece the impression coping, and we remove it because it's held in place by a screw that screws into the implant. So now with the impression coping removed, we've arrived at the most important part of the long-term success of this implant. And once again, I've been placing implants for 13 years, and to my knowledge, I have not had one fail yet, and that is rare. I mean, I like to think it's skill, but there's probably a lot of luck in that as well. So the crest of this implant needs to be flush with the bone or slightly lower than the bone level around the whole circumference of the implant. So if there's a spot anywhere on this implant where it's not flush with the surface, I would need to drill this implant down further into the bone. The reason is, if not, the grooves of the implant easily catch bacteria and can cause the implant to fail if it gets some sort of gum disease around it. Then you can move on to the next step. Here I insert a healing abutment by screwing it into the implant. An implant heals best when it is left alone to integrate with the bone for about 3.5 months. In fact, that is why we don't start making the crown until that time, because if you put a crown on top of it, you're going to be chewing it and bothering it the whole time. The healing abutment is tightened into the implant so that the gums nicely form around it for the final crown. So here we cut a space for the healing abutment. Now, you're probably thinking 3.5 months is a long time. Why does it have to take so long? It can be done quicker than that, but there are two issues with doing it the quick way. First, the implants tend to fail more often because you immediately start chewing and putting pressure on them, and putting pressure on something trying to heal is never a good idea. It doesn't integrate well. The second issue is they look worse too and have more issues over time. When done quickly, at first everything will look good, but as things heal, especially the gums over the next few months and over the next few years too, you can get unpredictable gum recession and more issues arise if that happens. Now, as we finish with the sutures, you will see what it looks like at the end of the appointment. This metal disc piece that's the healing abutment is exposed, but if the patient wants, there are temporary cosmetic options to cover this. Most people only do those cosmetic temporary options on the front teeth because there's a cost to it and the metal can't really be seen all the way in the back of the mouth. And you can see at the end of this appointment, it does look pretty odd, but now let's fast forward to 3.5 months later. It looks much better around this healing abutment. Everything has healed nicely, the gums are forming great, meaning the implant is firmly integrated in the bone and the implant is ready for a crown. Most of the time, gums form nicely around the implant healing abutment, but if they don't, it just means they are really healthy gums, so it's nothing to worry about. So now we have the healing abutment fully exposed. So we unscrew the healing abutment at this point so that we can uncover the implant. And now we can move on to taking the impressions because now it looks nice just like this. Quickly, my favorite toothbrush, floss, and other dental products by far are in Amazon affiliate links in the description below this video. Those dental products will give you stunning results every time you clean your mouth. And you can also watch my video posted at the end of this video to see why they are the best and how to brush and floss your teeth with immaculate results. Remember the impression coping we removed at the last appointment? We're going to screw it back into the implant and take impressions of it while it's in place. We tighten that impression coping to 35 Newton centimeters of force back into the implant. And that is what we will tighten the final crown to so that it stays into place without the risk of the implant or the screw becoming stripped. And that hasn't happened to me, but I can imagine it would be the worst if it did happen. Next, we use our light to set this white material to cover the impression coping. Otherwise, all the impression material is going to get into that and it will be a nightmare to get out. Now we move on to actually taking the impression with a material called polyvinyl siloxane. The purple layer here is the bulk of the impression and the orange layer is what picks up the details of the impression. We push that impression over the teeth and the implant with its impression coping and it's going to sit there and it will set after 2.5 minutes. After the 2.5 minutes are done, we remove it from the mouth. Now we're going to take this impression and the impression of the top teeth and we're going to send it to a lab and we're going to take a shade that we want the tooth to be and match it to the teeth right next to the implant. The lab will put that impression coping we just used back into the impression again and then he'll attach a dummy implant to that impression coping. The end result is an impression that looks like this, from which the lab will make a stone model with a dummy implant in it. And now the implant will be in the exact same place that the implant is in the mouth as well. The crown that the lab will make with the shade that we took will be made on top of the stone model and the dummy implant. It normally takes the lab a few weeks to make the crown, so for the final steps of this visit, we remove the impression coping from the mouth and put that healing abutment back in place. And now with the healing abutment in place, this is what it looks like as the patient leaves this appointment. So let's fast forward to the last appointment a few weeks later, and you can see now that the gums actually have formed nicely around the healing abutment, so we won't have to numb likely for this last visit. So I immediately unscrew the healing abutment so we can see what the implant looks like underneath. It may not look like much to you, but to me, that is beautiful and everything is looking very nice for the final crown. Now we have the crown back from the lab, so I take it and I'll start to put it in the mouth into the implant. And you will immediately notice that there is a hole in the top of the crown, and that will be sealed off later. So I take that crown and I initially fit it into the implant, and then I take my little driver and I put the screw into the implant so it secures it into place. I tighten the crown to 35 Newton centimeters once again. At that tightness, it will make it sufficiently tight without the risk of stripping the implant. Now, most of the time as I'm trying this crown in, it will need little adjustments. So I'm constantly looking for things I need to adjust so that the crown looks and feels nice. First, I'm looking to see if the crown goes down all the way to the implant. I'm also checking with the floss to make sure it butts up against the adjacent tooth perfectly so it won't get a lot of food caught in it. I also check to see how the crown feels when biting down. If any of these little criteria are off, it can cause functional problems or pain down the road. And so I want to make sure I get it right at this appointment. Everything looks good on this crown, so now it's tightened to 35 Newton centimeters. And now I just need to seal off that hole with a white filling. To do that, I put this Teflon into the hole. The reason for this is if I ever need to remove the crown, I can easily drill out the filling and unscrew the crown without the fear of accidentally drilling the screw with my drill. So this Teflon is easy to remove if I have to do that, and it creates a buffer so I don't nick the screw with my drill if I ever have to go back in. And you may be wondering, why would I ever have to go back in? Sometimes the screw that holds this implant into place comes loose, and all I have to do is just open it up, quickly tighten it, and seal it again. Now the next step after I pack the Teflon in is to etch the surface of that hole that was placed in the crown. And this will create a strong bond with the white filling that I'm about to put in. So I put that etch in, and then I rinse out the etch, and then I prime the surface of that crown. And then next I place bond into that little slot that's there. I normally use a lot of air and suction to suction off the excess bond, and then I light cure it, which sets the bond into place. And now everything in that hole is ready for a white resin composite, which will match the shade of the crown. So here I mold the white resin so that it looks nice, and I set it with the curing light. And now all I have to do is smooth off the filling, and with the blue biting paper, I have the patient bite down to ensure that they are biting evenly. Now, I smooth off the filling, and with the blue biting paper, I have the patient bite down to ensure that they are biting evenly. If there are blue spots on the other teeth and not any big spots on the crown, then they are likely biting evenly. And then I just smooth and polish the filling off just a tad, and here you have it. Now, many of you may have lost the original tooth due to a lack of inadequate hygiene, and you may not even realize it. Watch my daily dental care video I have posted now for the best technique, tips, and product recommendations for a stunningly clean mouth that avoids tooth decay, gum disease, and gives you fresh breath. The best dental products that I recommend are in Amazon affiliate links in the description below. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.